Well, it's a brand new month, and May is a month to call awareness to a number of chronic conditions that affect women. That includes Ehlers-Danlos, fibromyalgia, arthritis, and lupus. Dr. Holly McKenna with Dara Wellness joins us now to talk about some of these chronic conditions, one of which you are very familiar with.
Yes.
And why we should be bringing awareness to these.
Yeah, so I happen to be a zebra, for those who are familiar with the term. So I have Ehlers-Danlos. I actually had symptoms of it since I was about 15 years old, but just got diagnosed from the Fascia Institute here in New Orleans just over a year ago.
Wow.
Right? So, and that's as a physician. So part of why this month is so important is because Ehlers-Danlos, hypermobility, a lot of these kind of chronic conditions that primarily affect women aren't always easily seen in the medical system, and women who are dealing with these, and men as well, feel unseen, unheard.
I'm sure it's exhausting to have something going on, you can't quite pinpoint it, and your doctors may not be necessarily looking for it, so they're not seeing it for you. And because of that, people do often have, other conditions, maybe depression, maybe anxiety, because they just can't figure out what's wrong. You offer a virtual healing circle.
Yeah, so
for folks who have been through this.
Absolutely. So I think because of my own journey as both a patient and a physician, and a mom, because my kids actually are also dealing with some of these issues.
Sure.
I am offering a 3-day event that starts tomorrow. It's virtual, so folks can kind of tune in from the fest if you're out festing, or
Sure.
watch it later. And it's going to offer empowerment, education, and community, really community building, because as we've said, it's a very lonely experience when you're dealing with something chronic, and when it's not been identified by your medical team. Oftentimes people lack the skills to maybe get their needs met and to express those skills. So things we're going to be working on are mind-body medicine, things to help calm our stress level, because stress does play a big part in inflammation, but also in those communication skills, so you can talk to your medical team or your loved ones about what's going on in a way that they can hear you, because emotions do get high when you're feeling not your best self.
Absolutely. And then you're trying to explain it to people who are saying, well, there's nothing wrong with you.
Right, because you look fine. You look fine.
You look fine.
Yeah.
Speaking of that, can you explain Ehlers-Danlos a little bit more? Like, what is that if
Absolutely.
somebody maybe is going through something and doesn't know that their symptoms match up?
Yeah, and I have a lot of patients, because I do integrative medicine as well, who come see me and end up getting that diagnosis for me. So Ehlers-Danlos is one of a series of hypermobility syndromes.
Okay.
And what it means by hypermobility is kind of hyperextended joints. And being hypermobile in itself isn't necessarily a bad thing. A lot of dancers, athletes are hypermobile, and that's a big advantage. Like, my husband was a pitcher in college, and having hyperextended elbow and wrist is going to make you throw that ball so much faster, right?
Sure.
So it's a lot of active people have this, but what gets it into the more syndrome element is having pain, having a lot of dislocation or subluxation of joints, so joints kind of coming out of socket quite easily. Also bruising easily, and having skin that's kind of more stretchy. And it's really about the fascia, so it's the connective tissue that's not quite where it needs to be. So we also see things like irritable bowel syndrome, having fertility issues or period issues. Also, there seems to be an association with mast cell, which is one of the cells in our immune system. So being very allergic and very responsive to things in different foods or things in the environment cause you to have a real allergic reaction.
Sure. You mentioned that for a lot of these, inflammation plays a role. What is one way that we can maybe reduce that inflammation?
Well, a lot of it is going to be decreasing that stress response and
Okay.
engaging in deep breathing, which I'm a big fan of.
Yes.
And then also looking at your diet and having more of plants, just like the people before
maybe
us
like our
ate.
ancestors. Dr. Holly McKenna, thank you so much for joining us.
Absolutely.
I appreciate it.
Thank you.